Welcome back to ALLSMITH. Today is a very exciting conversation that's not just meaningful, not just professional, but it's personal. And as you guys know, this is a show where we explore ideas, habits, and people that help us to upgrade our operating system in the pursuit of our peak expression in life. Today's guest is a board-certified neurosurgeon, a spine specialist, and the founder of the Institute of Neuro Innovation. For more than 2 decades, he's been operating at the front lines of brain and spinal health, helping patients recover from complex neurological conditions through advanced surgical techniques and minimally invasive procedures. I'd love to stop the intro there. But I also have to note, guys, that what makes this conversation especially fascinating is that he doesn't just study the brain and the spine as simple structures. He studies them as an operating system of the human experience. That's where it aligns with ALLSMITH. He studies how we move, how we think, how we recover, and how we handle stress, and how we age. Everything flows through the brain, the spine, and the nervous system. So today we're exploring what it really means to protect and optimize the system in a modern world that constantly pulls us in the wrong direction. Ladies and gentlemen, I'd love to welcome Dr. Vokshoor to the show. What's up, man?
Hey Bryce, thanks for having me. This
I
is
think what you're
this is such an
doing
honor.
is, yeah, man, I think what you're doing is really special. Like the thing that, like when I was putting together that intro last night, I wanted to stop it short because I know the attention span of most people. But I was like, dude, the nervous system is so broad and complex, and so many people misunderstand terms. But the nervous system is in alignment with how we move, how we think, how we recover, how we handle stress, and how we age. And so before we really jump into today's conversation, can you help give a little peek behind the curtain around some of these big terms of what is a neurosurgeon? What does neuro really mean? Like, how does that relate, and why should people care?
Yeah, it's by the way, just a big shout out to what you stand for. We have like the medical practice and the complex surgeries that we do, and then we have this incredibly important humanistic side that really wants to improve the lives of the living well, not just the ones that are afflicted with what we consider a disease or, something that has a name. And I think what your podcast and your type of community stands for is essential for human evolution going forward into engaging our operating system at the level of its reward, of its little levers. And I'm, looking forward to diving much deeper with you in multiple conversations, hopefully. But basically, neurosurgeons are the type of doctors that learn how to surgically correct some of the disorders or dysfunctions of the nervous system. The most simplest one is, someone has a large herniated disc that pinches their sciatic nerve or pinches a nerve in their neck, and they're miserable, and they've undergone, some chiropractic massage or inversion or acupuncture or even some cortisone injections, and nothing has worked, and their lifestyle is imminently affected to the point that they cannot do, say, 90% of the things they used to be doing. They can't go strength train. They can't do cardio. They can't barely get in and out of a car. Some people don't even leave their house for months. In those settings, neurosurgery is an absolute godsend because we have these incredibly evolved techniques where we've learned to sneak into your body and sneak out without doing much harm to the surrounding tissue. And that's still evolving, and we have robotics now and a lot more precise ways of placing certain spinal instrumentation, etc. But basically, if we can sneak into the body, shave the offending pathology, whatever that may be, and leave the nervous system intact, it then relearns how to do everything. We don't actually do anything specifically to your nervous system except give it room and give it love, give it oxygen, glucose, and everything else. And the part that's really interesting is, can we use the experience of a patient to optimize their outcome. And that's where things like breath work and optimizing your microbiome and optimizing sleep and other subtle physiologic things can also affect your overall outcome after a medical event dramatically. And those are very important.
You painted such a great picture there, man. You should be a freaking artist painting a blank canvas to create some imagery for us. Because what's funny is that as somebody that practices breath work daily, did it this morning, did my prayer, did my meditation, kind of got the mind and the body ready for this conversation today. There's still something about the human experience that when somebody else is talking, our breath gets stuck. We're like listening and we're like bracing for whatever reason. And we hold tension in different ways. And the moment you mentioned breath work, I was like, And then the other thing that you noted that was very cool was creating space, giving it love. I pause to give that a little bit of like the ability to marinate into the ears of our consumers today, because how often are we just trying to fix, right? Like in this particular instant, there might be a nerve impingement, there might be a bone fragment or a bone spur, there might be something going on with the muscle tissue or a tear that you're going in. And I love the way you talked about like seamlessly sneaking into the body where it's very small and minimally invasive, not like, let's cut it up and let's get in there raw. We got to do it the old school way. It's like, no. The body is the most fascinating system we've ever seen. We don't even totally understand. It's like the ocean. There's still so much to be explored.
It's a
And the
great way of putting
fact
it.
that, and the fact that you're just like, I mean, excuse my French, but you're just like, we don't fuck with this. We assist, we support, and we
Right.
try to remove certain things that get screwed up based on the human experience or from unique experiences that may infiltrate the nervous system. But what I'm curious about is, okay, you went in, you removed said component that may be causing the pain, whether that's, lumbar, cervical, something there associated with with the spine or the brain. But there's also a rewiring and a reteaching to the human of like, hey, we need to relearn who we were, kind of back to our inner child before this pain existed. Because when that pain's there, it teaches your protective system to be like, ooh, should that movement be okay? I don't do that movement. That movement hurts. And we start to create these limitations. So there's a psychological and a psychosomatic component to the systems and the symptoms that you're also going to have to reteach. How does that fit within your processes and procedures?
You just gave the best lecture on chronic pain. So that's that's in a nutshell what we're battling with chronic pain. And there's avoidant behavior when your body is guarding against something that it knows it's going to hurt because of an old injury. Even if the offending agent is gone, the body has to rewire itself. So neuromuscular re-education, which comes
Mm,
from the way our brain and the spinal cord get their coordination back with the exact muscle group that you're enacting and strengthening it and creating flexibility around the joints that are involved is essential. And what's really fascinating about the way we're wired is so you need shoulder muscles, for example, to have a good shoulder joint. You have good shoulder because inherently shoulder joints very loose. But if the nerve going to your shoulder joint is pinched in the neck, then all bets are off because you can't create good muscle to have a good shoulder joint. So if you have one bad pinched nerve in the neck, you could potentially have shoulder instability. You can have knee instability from a bad nerve in your lower back. You can have hip instability. So the fact that this tiny twig of a wire is innervating this massive piece of meat called like the
yeah.
psoas muscle or the deltoid is fascinates me. The scale of things absolutely fascinates me because for neurosurgery, we need a microscope with 40x magnification. And to look at this huge muscle, you don't need any magnification. So I love a few things you said there. There were kind of golden nuggets for chronic pain. Is that chronic pain affects the brain in a way that You have to go back to your inner child. That's a really cool way of putting it, because what happens is between age 0 and 2, you're myelinating, you're making these wires super robust of things that have become automatic for the human experience. So, say walking. And then later in life, you have a problem that prevents you from walking well. Let's say you have spinal stenosis or narrowing of the nerve canal in your spine. Your brain rewires itself and says, oh, this now has to become a conscious experience again. And now you have to think about walking, because the mechanisms that used to be automatic are no longer automatic because of the loss of the fidelity of the nerve signal. And then you have something that was automatic uh, become not automatic. And then after you do decompressive surgery to create the nerves pathways again and make them high fidelity, then the brain has to go back to learning how to walk like the inner child. And there's many, many examples of this, but that's why rehabilitation is so important. And part of it is structure, what we're doing in surgery. Part of it is physiology, what your blood pressure is like, what your hormones are like, what your muscular build is like, what your protoplasm is like, and part is psychology. So how are you going to rewire your brain to the task at hand? And the goal for I consider everyone an athlete. What is your sport? Your sport could be walking, but movement is life. You can't not move. You want to move because your lungs, your intestines, everything depends on movement. So any body part that moves is healthy for our physiology. So I feel like whatever it is for you, we can create a program around it by which we affect your structure, your physiology, and your psychology for betterment of the quality of your life.
Yeah, that's a really cool depiction. The other thing that I would add to that is a lot of it's also sales, right? Like it's easy to have unique optimism as a child where you're like, oh yeah, like I could become an Olympic athlete one day, and then the next day I'm a firefighter, and the next day I'm a doctor, the next day I'm a lawyer. And then as, in the example that you gave, your nerve canal starts to narrow. Now you're experiencing this pain. Well, the psychology now starts to narrow the ability around what's available to you. Oh, now I'm going to be stuck behind a computer. Now I'm going to be sedentary. Now I'm not capable of doing X, Y, and Z performative craft. So then what happens is psychologically, our worldview starts to narrow. You think about depression, you think about anxiety and that spectrum and how that plays, and how pain can be the catalyst or the gateway drug to opioids, to a very pessimistic mindset, to misery loves company. Now we look at the environment that we're in, we look at the people we choose to spend time with. You can see how this can be a domino effect in the right direction. You can spiral downwards very easily.
So
But
true.
I think what's really important within the healing modality is when I say childlike movement, I also incorporate childlike optimism. And that means that you talked about this level of conscious competence. Like when you eventually acquire a skill, i.e. walking, I don't need to think about it. I just do this because I get out of bed and I'm walking to the toilet to use the restroom first thing in the morning. But when you experience extreme pain, plantar fasciitis, nerve pain around the sciatic nerve and the piriformis compressing that sciatic nerve, something in the cervical where you can't turn your head a certain way, you're trying to like really rely on the cameras on a car because you're like, man, I can't like turn, like something's compressed up in my cervical spine. Freedoms start to get taken away. So now it becomes conscious competence as opposed to unconscious competence where you're like, whoa, spine doesn't move. Can I turn the entire back? And now like you're relearning how to move. So that becomes the new default operating system. But then surgery takes place. You're communicating, oh yeah, you should have free range, maybe with some physical therapy. We're going to have to strength train. We're going to have to add X, Y, and Z supplements, collagen. We might explore PRP or some of these other things. But people are very distrusting. They're like, hey, for 10 years, I've had to operate this way. Why should I trust you now? So there is a buy-in and a sales component, not just of you to the patient, but of the patient to the patient. How do you guys navigate that post-op? Right? Because on paper and scientifically, like everybody can be a pseudo lab rat of like, hey, this works, science says it, trust the science. But in a world that's very distrusting now, how are you guys creating buy-in and the post-op processes to ensure that people get back to a high quality of life?
I've become such a better doctor because I've had orthopedic injuries. And I've gone through the what would you call the stages of grief. The stages of an injured athlete is, poor me, I'm on crutches, this body part doesn't work well. And you have to embrace the suck, if it's a military term that I love, embrace the suck if you're gonna get back into it to any degree of competence again. So certainly there's a spiral down, and everyone's different. Everyone's psychology is different. And our operating system has its own reward levers that I would like every one of us to engage to. And that's what I encourage my patients to do is engage your operating system, see what your pain points are like. Is this more psychological trauma, physical trauma? Is there an emotional component? How do we biohack into your nervous system for a better day ahead? And everybody has levers that we usually find through a lot of conversation. And, if I could say, oh, Bryce, you have the nervous system type 2B3A or something like that. And this is what the best biohacks for that nervous system is. And that's, one of our goals at this place we call the Brain Spa is what supplements are going to work on you? What electrical frequencies are going to work on you? What red light therapy frequencies does your body respond to? And every one of us does have a biohacking cocktail that we could find, except, there's so much information out there and there's not a lot of hard science randomized controlled trials. So a lot of my patients are depending on influencers and cool ads and things of that sort. And I'm always like, man, I wish we had a scale of strength of evidence based on randomized controlled trials, real science, good responsible science, not the type that just tries to get NIH grants after NIH grants because you're a tenured professor. And then 10 years later, we've spent billions of dollars on Alzheimer's with no answers. So not, high integrity science, which most clinicians and good scientists actually, most good scientists know their own blind spots and know that there's a conversation to be had about where they could be wrong. And I think that's really important to re-emphasize again that science is on trial because new evidence will come and improve our understanding. Science is never dogmatic. It's never flat. It's never an absolute. So I wish we had better strengths of evidence for these biohacking modules that we try to employ on a daily basis on ourselves, on my patients. And we will have this scale of strength of evidence and also clarity of benefit going from probably doesn't do any harm to, oh, yeah, there's definitely some benefit to this is clearly beneficial for the human physiology. Like creatine is a great example. After years of being kind of anecdotes, now there's robust evidence for its effects on many, many aspects of our nervous system. The GLP revolution, the GLP-1s are going to be amazingly part of that scientific revolution. I'm very excited about them. I, defer to endocrinologists and people that are more deeply in it to pick which one should go with what body and and their initial indication was diabetes, but they can affect many systems, including the nervous system. So I'm very excited about that science coming out. But without science, we're just throwing arrows in the dark.
I mean, yes and no. I think in theory, science is throwing shit at the wall and seeing what sticks. It is. I have this thought and I'm going to explore it. And then based on the evidence that comes out the other side, I'm going to have this ideation to then pay it forward. And I think it's important to note that, right? Like, because I think for a while there, everybody was saying, trust the science. And there was this like social hierarchy of like, here are my credentials, trust me. And it's like, okay, We trusted Dr. Fauci and we had all these deaths. We trusted certain
Yeah.
people and it led down a rabbit hole that, I mean, I don't want to waste our time today,
No,
throwing
that's
all
where I
those
think
things
credentials, including my own that happen to be, behind me, it's like they're bullshit unless they are creating a path for you to help people elevate their understanding of everything that's
100%.
going on. Unless
100%.
I can
It's Ted
communicate the
Lasso
science.
101. Be more
Yeah.
curious than judgmental. And if you're
Yep.
just trusting somebody because of the DR period in front of their name, then you're doing it for the wrong reasons. And what I love about what you said is that you mentioned anecdotal evidence, because a lot of that is really valuable in the beginning, because you pause for a second and you go, okay, those are real life experiences from real people. If I'm
100%.
just relying on said study and I'm saying, oh, there's no studies according to X, Y, and Z person, okay, well, who's funding that study? They're incentivized based on that NIH grant that you talked about, which is, if you have incentive, you can then backtrack and shift behavior. So what I want is real science. And I think that's
Yes.
what you're doing, which is why I
Huge.
appreciate the fact that you're not only minimally invasive in your procedures, but you're open to the fact of this brain spa component, which you briefly mentioned, which I think is so freaking cool, around, you know what? There are some benefits to this biohacking perceived bullshit that could enhance the buy-in with the consumer. Okay, if they're underneath red light, sauna, cold plunge, the integration of creatine, movement, optimizing their environment, guess what? That's significantly better than sitting behind a screen just playing around on ChatGPT and, MedMD and all these different things that just create chronic anxiety and pessimism.
That's really well said, and I'd love for us to be able to sift through the fog of the different AI chatbots, but it's going to be very challenging. And I think all my patients come now with a whole horde of information from Claude to Perplexity, and I don't mind it because we have a very kind of boutique type of practice where we can spend the time. We're not it's not a volume play where you have to, some doctors have to see like 60, 70 patients in one clinic. I mean, can
Mhm.
you imagine the brain of a physician undergoing that and actually giving
Yeah.
care to every single person?
But also to
So,
note, what I love about what you said is, because of the boutique side that you're in, you can give the actual time to listen. And
yep,
what's tough is, from a systemic standpoint, these doctors are not bad people. They're very well educated. They're trying their best to solve problems that are very complex and be there for people, but they're limited in their time frame. They've got that 6 to 12-minute window per patient. They have to see a volume of patients, and if they don't, they get pressure from the hospital owners around profit. They get issues with, hey, why did you schedule that CT scan or that MRI? We only get this many a month and it costs this much money. I mean, anybody can log into Netflix and watch The Resident, and you can see, oh my gosh, like, there's people that are genuinely trying to provide great patient care, but now they're threatened to potentially lose their job. Doctors, nurses, PAs, MPs that are now, like, their livelihood is threatened based on the profit, and not to mention even the lawsuits. And so now doctors are spending so much time on the legalities and the notes that they're not able to provide the patient care because they're operating from a place of fear rather than a place of love.
God, so many good points there. I couldn't have said it better, but I tell all my colleagues, like, we're practicing defensive medicine, which is terrible. So all these notes come with huge legal disclaimers, and it's like we never had this, like medicine was practiced, of course, terrible handwriting the doctors used to have, but it was practiced in a way that was almost like its own shorthand because it was more intentional and would get the meat across rather than a bunch of disclaimers. But now that every note could be scrutinized in a court of law by a very slick attorney, opposing attorney, then you're practicing defensive medicine out of fear, probably ordering more tests than need be, and possibly doing unnecessary procedures because they're under the gun of some type. Even like with things you see that are terrible is the doctor peer review system, like Dr. Death, who's a neurosurgeon doing time in Texas right now. That is an extreme form of doctors not policing themselves. But on the other hand, you have doctors trying to police themselves, and it always comes with a legal binding environment where you're like, oh, if this causes the lawsuit, then I'm going to do this particular procedure every time so I can avoid a lawsuit, instead of letting some patients potentially heal on their own. So defensive medicine, fear-based medicine also sometimes creates bad medicine.
Yeah, that's so well said. It mitigates critical thinking. I also think it causes over documentation based on that incentive model of like, hey, if I document it this way, we can bill insurance this way, which means the hospital gets the payback. And I mean, we saw that, right? With some of these hospitals, we see certain things with Pfizer. We've seen it with Kaiser, where there's over documentation, and then the hospitals are like, "Hell yeah, I'll pay that fee or that fine because we're making 50x over here. Who cares about the fine at that point?" And it's just become something that, at the very least, I think it's important to talk about. It's important to notice. I'm not saying that I'm over here on a high horse and have the absolute solve, but I am saying that, like, just do the next right thing, guys. Like, actually care about people. And when you do that consistently over the course of time, you create a ripple effect where if you from the top are doing the next right thing, you're probably minimizing lawsuits. You have, every place has an asshole that's going to sue over something. But you can minimize those things by genuinely creating, like you said, the patient experience. You can have gas, which is what I call give a shit. And when you do those things, people heal because now there's trust. And when there's trust and there's love and you're giving clear like feedback of, hey, here's the procedure that we're going to do. Here's the risk. Here's the reward. I give you my scout's honor that if you were my wife, my mom, somebody that was part of my family, I'm going to do my absolute best to get you back to living a life that's pain-free and doing the things that you love and you care about. There's no guarantees. However, what you've done up until this point hasn't worked. And so I want to come in now and help serve you in a very loving, organized fashion. And we're going to be overly transparent with what we're going to do. And we're going to try to make this as cost effective and affordable to your insurance as possible. And we're going to be with you. We're going to co-pilot your journey back to a pain-free, beautiful life. That right there is patient care.
Sign me up.
Vers- exactly.
You're hired, man.
And you're gonna make way more money doing that, especially in a boutique fashion, because you're being truthful and you're being honest. But unfortunately, those things can't be said because it creates the realm of overpromising, potentially under-delivering, doesn't take into consideration potential, things that could happen. And then as a byproduct, it's like you said, operating from the defense.
But
I know
the words you used is exactly the words I used. They're almost like it was almost it's really cool to hear you say those words, because you always say, what is the next best step we can take together to improve your health? That's all we're looking for.
it's beautiful,
And,
man.
and yeah, and I appreciate you saying that. Your insight is valuable, very valuable.
It's cool, man. I want to hit some heavy hitters with you.
Okay.
Some things that I was really thinking about in the pursuit of this conversation. If the brain is the operating system of our life, what are the biggest daily habits that are quietly damaging the brain?
So the brain is another organ, just like any other organ. What's really makes it super special is its immunology. It's a little protected from the rest of our immune system, and the fact that it's so related to our what we call autonomic nervous system, our automatic nervous system, but we don't think about. So everything from an abnormal blood pressure, abnormal heart rhythm, bad intestinal health, bad sleep, those are very, very basic things of life can affect brain and can make it age faster, can make it damaged. The most important thing, I think, the lowest hanging fruit is sleep. If you can get in a position of comfort where you can get 7 hours of sleep, 7 to 8 hours, but 7 hours is plenty. And quality sleep, that means you have at least an hour of deep sleep, an hour of REM. You've done amazing things for your brain. Just that reset, because the brain depends on information purging, letting go, forgetting things it doesn't need, and concentrating on things that it needs. And the content of it is dependent on physiologic parameters. So, again, hormones, blood pressure, what we call neuronal health, which means neurons have to have enough substrate. That means fats, proteins, and carbohydrates. You can't just, like I know that ketogenic diet, for example, is something we use in epilepsy for brain health. And it has shown some benefits. Very interesting the way it manipulates the metabolism toward like ketosis. So, other than in those disorders, you do want a very balanced diet and you want movement because exercise is one of the only things that's proven to prevent dementia. Out of all these, incredible studies that we've done, movement and exercise, including strength training, is one of the only things that's proven to stave off dementia, which is one of the most scariest things because it truly unravels you from within. Let's say you have a healthy body, you have a healthy heart, lung, kidney, everything else, and your brain goes. And your thoughts, your feelings, what makes you a person is the literal definition of you. That's what's very interesting about the grander nervous system as an organ. So it's not just the brain, it's brain, spinal cord, the skin, the the gut, the heart, they're interacting with each other in such incredible ways that I think just concentrating on the brain is somewhat mistaken because the autonomic nervous system, the vagus nerve, the rest and digest and recover is as important for the brain as the train and have good healthy stress and be goal driven and get better at what you do. So if we can oscillate between those two and know that every day is either a training day or a recovery day, I think that's a very healthy state for the brain.
I like the way you described that. And a lot of what we talk about is just contrast, right? The sauna, the hot and the cold, and not
Hmm.
necessarily specificity because those are stress. So I don't mean for people to like hold on to that with like exactness or semantics. It's
Exactly.
more so the
No
contrast,
orthodoxy. Exactly.
right? The push, the pull, the squat, the hinge, the running, but also the resting. And I think you described it very well, understanding that you need light with dark. You can't just have all one thing and not the other. The ketogenic diet is a very interesting one to explore. I'd be interested in a separate conversation to understand your thoughts on how the body processes protein and when it's craving carbohydrates and it goes through something like gluconeogenesis, the conversion of protein to glucose, how that affects ketosis, how that affects brain health, how that affects body
You're taking me back to
composition.
my roots.
Nice, man. It's something I'm genuinely very curious about because the body inevitably is going
It's
to figure out how
fascinating.
to get their sugar. But I think most people, modern day, the thing I love about steering people towards something like a ketogenic diet is that, to be honest, they're probably not going to do a ketogenic diet. They're just going to do a limited ingredient diet. They're going to be in pursuit of proteins and fat. And as a byproduct, there's probably going to be additives. There's going to be certain things that they integrate, especially in the realm of beverages that have added sweeteners or things that they add to their coffee. Just to be speculative there on normalcy behavior that we typically see in the world. But the other thing that I want to touch on, which I think you hit the nail on the head, is sleep. As somebody that is in the health and wellness industry, I'm pushing sleep all the time. And I mean, just yesterday, man, like I had 3 or 4 clients that are just like, "Oh, I'm not a good sleeper." That's such a closed-minded perspective. It's like, no, 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 no. What are the habits that are leading to you not being a good sleeper? Are they ruminating thoughts? Can we do an evening brain dumper journal session? First thing in the morning, are you going straight to caffeine and the phone? Or can we get outside, get some deep breathing and some sunlight in the eyes to echo Dr. Andrew Huberman? What's going on with our habits in pre-sleep routine, screen time, anxieties, and anticipation of discomfort in workflow in the pursuit of trying to make money in very expensive California for a lot of our listeners? What are your suggestions if you could give people like 3 main takeaways to dial in their sleep aside from right now it sucks, but the having the optimization that like it can improve and get better?
Yeah, no, then that's creating that mindset of, hey, I'm gonna oscillate in and out of my optimal performance and this state of rest. And unless I can go to this state of rest, I won't have optimal performance. So easing into it by saying, I know all this stuff is going on, psychosocial stress, financial stress, physical stress, some pain. But if I can do this correctly of letting go and allowing my nervous system to let go and forget and purge and get into this lucid dreaming pre-sleep state, if I can just get myself there, I know I will tackle everything much more efficiently and more effectively. And if you can, and that's the logical part of it, the sort of like the physiologic part of it is, can you actually let your sleep physiology take over? And sometimes anxiety prevents that from happening. Sometimes physical pain prevents that from happening. So it does require you to have um, enough insight to say, okay, I need to just put the screen down and I need to try to do some deep breathing. So mindset, initially say, I need to do this or I want to do this for my health. Breath, so increasing the length of your exhales through deep breathing puts you in a meditative state to increases your vagal tone, and ultimately comfort. So people have bad shoulders, bad knees, bad backs. Do you have to do the side sleep with a pillow between your leg, with an appropriate pillow to keep your neck neutral? And those can be very individualized. Some people just sleep on their back very comfortably. I happen to not be able to do that very well. I have to kind of turn sideways. But there are maneuvers that you can do that you can literally let your body get into a most comfortable position. Some people need medications due to bodily pain. Some people need medications due to severe anxiety. We don't want that to be a routine. We want that to be an exception on a really bad night, as opposed to, oh, I just take my Ativan, every night. And, my mom used to do that. And it was an older generation that were just given pills for everything. Their doctor was like, oh, you can't sleep? Here's an Ativan. And that's a very powerful medication. So I got her to finally stop and use it only that once a month that she absolutely needs it to get to sleep. So I think those are some of the, basic stuff that I
Yeah,
use.
I love that you're talking about spinal alignment. I think that it's important to note that medications and big pharma and reactive medicine, surgeries, all those things, they are a tool. They're not like, they shouldn't be the first part of the conversation. We should look at lifestyle. We should look at all the things that you talked about earlier around the gut brain axis, around movement. I mean, if we could put exercise in a pill, it would not stay on the shelf. It would be the highest grossing drug ever, higher than Ozempic, without the same side effects. Of course, people are going to get tweaks or a couple things here and there, but like what I very much appreciate, Dr. Vokshoor, is that you're calling a spade a spade. You're painting the picture in a very digestible fashion that isn't just selling your practice. You're understanding that humans are going to human. What things can we do proactively in the realm of preventative medicine? And then if we need reactive medicine, it's here. And I think in doing so is a very honest testimony. And I mean, today was our version of a little coffee date, but we're definitely going to have to grab dinner after this.
I appreciate that. One of the things I tell my patients is, we just want like some physical ailment has derailed you from this rail of rehab. So let's say you're on the rehab wheel and something has derailed that. A structural intervention like surgery is just trying to put you back on that wheel so you can
Mhm.
rehabilitate, because all life is either training or rehabilitation. So I can't wait to do this again with you, Bryce. You've been I love the way you message things. You definitely have a incredible knack for using the English language to pierce deep within the human psyche for betterment and improvement of our operating system, which I truly, that's exactly what I'm all about. So I can't wait to do this as many times as you have time for.
I appreciate it, my man. One of the ideas we talk about a lot with ALLSMITH is just that every
Yeah.
human being is, they're sitting on a reservoir of untapped potential. And so
Yes.
that potential can only express itself through the health of the system that runs it. And I think what we're discussing here is stuff around movement, around mindset, around the brain, the spine, the nervous system, and the true operating system of your life and regulating that where it stays closest to homeostasis, where the peaks and the valleys aren't too large and in charge. And then as a byproduct, we realize that every thought, every movement, and every relationship allows us to capitalize on every dream and pursue the flows of that system. And it takes us back to that childlike experience where if you can dream it, you can make it your reality. And I think when you wake up with that level of playfulness, your nervous system is excited. It's not like, oh my gosh, I have to go back into the rat race and I have to do the thing. Like, it's not that mundane, like dull, dark human experience. It's like, whoa, I get to do this. Let's go do the thing. Here we go. And I've got this great community around me. I can't wait to go play with my friends in the human sandbox.
So great. I love it. And I'll leave you with our tagline: there's no health without brain health.
So beautiful, man.
Yes.
Dr. Amir Vokshoor, ladies and gentlemen, if you enjoyed my conversation, please rate, review, subscribe, and share with your friends. We definitely got to do this again, man.
I look forward to it, Bryce. Thank you so much to what you do. Take care, guys.
Thanks, guys. Stay on the hunt for who you've not yet become. Till next time.